Okay. Good day, everyone. So for today's recorded lecture, we are going to discuss your anxiolytics or your anti-anxiety agents. So for us to be able to understand the how this medication works, we need to first briefly discuss your anxiety. Okay? So pag sinabi nating anxiety, no, the very first thing that came to your mind is that pag sinabi natin anxiety, that is the fear of the unknown. Okay? That is the fear of the unknown. Wherein, pag sinabi natin kasing anxiety, that is the subjective response to stress. Okay, so pag sinabi kasi natin stress yan, class, okay, of course, we are experiencing it at some point in our lives, nai-stress tayo, especially that we have this upcoming examination, di ba? So, pag sinabi kasi natin stress, okay, these are merely objective. Okay, they are merely objective. Wherein, pag sinabi natin objective, sabi natin, no, in your, tawag dito, in your fundamentals of nursing, in your health assessment, pag sinabi natin objective, they are measurable. So, ano tong mga to? For example, we have here your mga vital signs natin, okay? So, kapag stress tayo, the response of our body, since na-activate kasi yung SNS natin or your sympathetic nervous system natin, of course, tataas yung some of our vital signs. Like, for example, yung heart rate natin, yung respiratory rate natin, di ba? Nagkakaroon din tayo ng mga pupillary dilation if we are under stress. Okay, so lalabas lahat ng symptoms na to once we are under stress. So, pag sinabi natin stress, these are just merely objective. But then, pag sinabi natin kasing anxiety yan, this is actually subjective. Kasi pag sinabi natin anxiety, nakalagay dito, it is an unpleasant emotional statement consisting of psychophysiological response. Okay, psychophysiological response. So, bakit siya naging psychophysiological response? Kasi it has an effect, no? Not only with your physicality, it also has an effect on your behavior, in your emotion, and even with your cognition. That is why sinabi natin siyang psychophysiological response. So pag sinabi lang natin kasing physiological response, that is just the reaction of our body to stress. But then pag sinabi natin psychophysiological response, this is what we call already your anxiety. Okay, so sabi natin tong anxiety na to, it's just like may nagkakaroon ka ng reaction, no? May reaction ka nang di mo naman alam kung bakit ka nagre-react. Kasi sabi natin kanina, in the first stage, your anxiety is the fear of the unknown. So how can we distinguish your fear from your anxiety? So pag sinabi natin anxiety, unknown ang kanyang cause kung bakit ka nagkakaroon ng reaction na hindi mo naman alam. But then pag sinabi naman natin kasing fear yan, there is a known or there is an identifiable stimulus. May it be an internal or external stimulus. So I hope you get what I mean. Okay, so yung anxiety kasi natin, class, meron po tayong 4 na levels. Diba? In the first place, of course, it's normal for us to feel anxious, no, in our daily basis. Kasi it has both healthy and harmful aspects. Nakadepende na lang yan sa degree and duration of your anxiety, of you feeling anxious, as well as on how well a person copes with it. Okay, meron siyang positive and negative aspects. So, meron tayong 4 na levels ng ating anxiety. So, what are the 4 levels of our anxiety? We have here your mild. We also have your moderate anxiety. We also have your severe anxiety. And of course, we also have your panic. Okay, that is the last stage or the level of your anxiety. So, pag sinabi kasi natin mild anxiety, of course, it is just a sensation, no, that something really is different and it warrants special attention. So, nagkakaroon ka talaga ng mga sensory stimulation, okay, that increases and helps us as a person to focus attention, diba, to learn, to solve problems, to think and act and feel and protect ourselves. Okay, so yung naka-divide kasi ito yung ano natin, no, yung mga aspects natin here. We have your physical, we have your cognitive, and we also have your emotional. Kaya sabi natin kanina, it is actually a psychophysiological response. So, hindi lang po siya physical, okay? Or physiological. So, sa mild anxiety, of course, it's actually okay lang na na magkaroon ka ng mild anxiety. Kasi, for example, ngayon, with your upcoming examination, ilang araw na lang, you will have your finals and comprehensive exam. Of course, you felt anxious kasi malapit na and it feels like hindi ka pa ready. But then, mild anxiety, sabi natin kanina, is actually good. Kasi it motivates you to make changes, no? Or to engage in a goal-directed activity. For example, ngayon, you're so focused, hyper-focused on studying for your upcoming examination. So, sa physical physical aspect natin, of course, yung mga vital signs natin, nagkakaroon ng increase in your vital signs. Like, for example, your pupillary dilation. Ano pa? Pwede kang magkaroon ng diaphoresis or excessive sweating if you are anxious, di ba? And then, of course, aside from that one, when it comes to your cognitive aspect naman, it increases your attentiveness and alertness. And for your emotional, nagkakaroon pa tayo ng minimal use of your defense wherein yung ating OLOF or your OLOF or your optimal level of functioning is actually intact. Okay? At this point, sabi natin yung anxiety natin, ano yung tumataas dito sa anxiety natin? It's your norepinephrine. Tama? It's your norepinephrine. Ito po yung mataas sa ating anxiety. And of course, aside from that one, mababa din po ang ating GABA. Okay? Or your gamma-aminobutyric acid. So, side notes lang po tayo, no? Additional learning. Okay, yung GABA natin kasi, tandaan niyo to ha, kapag may GABA, walang kaba. Okay, kapag walang GABA, may kaba. Okay, so yun kasi yung natin sa mga neurotransmitter that are affected kapag nagkaroon ng imbalance that is actually causing you to become anxious. Okay, so sabi natin kapag nasa mild level of anxiety, of course, tumataas yung ating norepinephrine. That is why stimulated po yung ating sympathetic nervous system. Kaya nga tumataas mostly yung ating mga vitals. Okay, so next naman tayo here with your moderate anxiety naman po. Okay, ito yung, pag sinabi kasi nating moderate anxiety, that's already, kung kanina sa mild anxiety, okay, it warrants you that something is different and kailangan mo ng special attention. Merong sensation na ganun. Pag sinabi kasi nating moderate yan, of course, that is already a disturbing feeling, no? That something is definitely wrong. And that person, okay, you, becomes nervous or agitated. Okay, so ano yung mga physical symptoms natin na lumalabas kapag meron kang moderate anxiety already? Again, we have your very popular na VANDA. Okay, ano yung VANDA natin? Nagkakaroon ka ng GI disturbances already. Okay, we have your VANDA, we have your vomiting, na-discuss na natin to before. We have your anorexia. We have your nausea or nausea. Your diarrhea. Or even constipation. Okay, it's either diarrhea or constipation yan. And of course, for letter A, nagkakaroon ka ng agitation. Okay, so in moderate anxiety class, a person can actually still process information. Okay, kaya pa niya mag-process ng information. They can also still solve problems and learn new things with the assistance from others. Although, nagkakaroon na siya ng difficulty concentrating, sabi nga natin kanina, independently, but still, kaya pa naman natin siyang i-redirect, okay, to that specific topic na kailangan niyang pag-focusan. For example, tawag dito, yung isang nurse na nagbibigay ng pre-operative instruction to a client, no, who is actually anxious about the upcoming surgical procedure. So, as the nurse is teaching, okay, ongoing ang kanilang health teaching, of course, the client attention might wander. Okay, wander or parang nawawala-wala yung kanyang attention, focusing on that specific topic or health teaching sa binibigay ng ating nurse, but still, that nurse can actually regain the client's attention and direct him or her back to the task at hand. Okay, ganun pa kasi yung natin sa, tawag dito sa moderate anxiety natin. So, pagdating naman sa cognitive aspect of this level of anxiety, of course, ano nangyayari? Nagdi-decrease na po ang ating perceptive ability. Okay? And for emotional naman po, okay, the use of any defense mechanism available. Kasi at this point, at this level kasi class, yung level ng anxiety natin or yung level ng neurotransmitters like your what you call this one, like your norepinephrine and your GABA, dito kasi, okay, nag-i-increase na po. Okay, mas nag-increase na po yung ating norepinephrine, and of course, yung GABA natin, medyo bumababa na po yung level niya. Okay, so next naman tayo here with your severe type of your, the severe level of your anxiety. So, of course, we need to avoid this, this level of anxiety as much as possible. Kasi for example, pag ikaw ongoing ang exam and then inatake ka ng anxiety mo and then it turns out to become severe at a level of this one, okay, naging severe yung level ng anxiety mo, of course, mahirapan ka mag-take ng exam, lalo kapag board examination yan. That is why, tawag dito, the day before the board examination, tawag dito, or even during your review season, dapat talaga you have to learn how to cope, how to deal with your anxiety. Okay, so yung mga sa physical aspect naman ng ating severe level of anxiety, we have your HIF. Anong HIF na yon? We have nagkakaroon ka na ng headache. I for inability to communicate. Letter F for your focus. Okay, ang focus mo na lang kapag nagkaroon ka kasi ng anxiety, hindi na dun sa mismong specific task at hand. It's on your physical symptoms already. Okay, mas dun ka na naka-focus. Ngayon, for example, sobrang anxious mo, nag-take ka ng pharma na examination, and then, as you take over that examination, tapos nung medyo nasa part ka na parang medyo nahihirapan ka na and hindi mo na siya na-review, or hindi mo na fast trackan, of course talaga ma-anxious kasi hindi mo alam kung anong isasagot mo. Okay, so kapag ganun, pag hinayaan mo lang siyang i-take over ka ng anxiety mo and then it turns out to become a severe level of your anxiety, that will actually happen. Mas mag-focus ka na lang dun sa mga physical symptoms na pwedeng mag-manifest sa'yo during that time. So, for cognitive naman po, aspect of your severe level of anxiety, okay, ayan na kung sa ating kanina moderate anxiety, nag-decrease lang po yung perceptive ability natin. But then, kapag dito na tayo sa ating, tawag dito, severe level of anxiety, your perceive ability is greatly decreased. Okay, is greatly decreased. And of course, you have that already inability to focus on major issues, on what really matters on that specific task. For your emotional aspect naman po, of course, lahat ng defense mechanism natin is already being operated. So, in here, sabi natin nakalagay dito, inability to communicate. Okay, bakit ka nagkakaroon ng inability to communicate when you're experiencing severe level of your anxiety? Okay, side notes lang po. Of course, in your communication, meron kasi rin mga tinatawag na perseveration and your verbigeration. Okay, pag sinabi, the difference between these two, pag sinabi kasi natin, for example, perseveration, okay, that is the persistence or persistent response to a question. For example, kumain ka na. Okay? Oo, kumain ako. Anong kinain mo? Oo, kumain na ako. Okay, so very persistent lang yung respond niya when he or she is being asked. Yan po yung tinatawag natin na perseveration. Pag sinabi naman po natin verbigeration, that is the meaningless, okay, repetition of phrase or word. For example, nakakita ka ng sinaksak sa kalsada, of course, kapag ganun, you might felt anxious, and of course, may ma-activate po yung ating SNS that will, tawag dito, that will make you feel anxious, di ba? So, pag sinabi kasi nating verbigeration, yan naman po yung, tawag dito, like, for example, sinaksak siya, paulit-ulit mo siyang sinasabi. Okay, nagkakaroon ng repetition of the phrase or word. Okay, so in here at this level of anxiety, severe anxiety, of course, there are already more primitive survival skills that is actually taking over. Okay? And sabi natin kanina, yung cognition natin, yung perceived ability natin, it decreases significantly. Okay? So in here, kapag nagkaroon ka ng severe anxiety, what will happen? Of course, the level of your GABA is greatly decreased, and your norepinephrine is also greatly or significantly increases. Kasi actually, class, yung GABA natin kasi, this neurotransmitter helps with your full muscular relaxation. Okay, full muscular relaxation. Wherein, di ba, kapag anxious yung isang tao, sobrang anxious ng tao, pansinin nyo, sobrang tight ng kanilang muscles. Okay? Their muscles are, anxious patients have a muscle tension all over his or her body. Okay? So, last level naman here, we have your panic. Okay, pag sinabi naman panic na pag sinabi naman nating panic, of course, yung ating kanina kung sa severe level of anxiety, nagkakaroon ng muscle tension ngayon, on its physical aspect, it will turn out into nagkakaroon na siya ng fatigability and of course, muscular weakness. And for its cognitive aspect, nagkakaroon ka ng personality disorganization as well and with the lahat ng mga defense mechanism na kailangan mo sanang gamitin, it already fails. Okay? That is why masasabi natin na tong panic level na to class, it's actually very dangerous. Okay? We can consider this already as a crisis. Okay? So these are the different levels of your anxiety. So let's proceed with your anti-anxiety or your anxiolytics. So yung ang ating mga antipsychotics, they are also called as major tranquilizers. Yung ating mga anxiolytics naman, they are also called as your minor tranquilizers na tinatawag. So in here, in your minor tranquilizers, okay, the common indication of your of these medications is to treat actually your anxiety disorders. And of course, the desired effect of this medication is to decrease your anxiety and of course, for your patient to be provided with an adequate sleep. Kasi yung ating mga minor tranquilizers, pag sinabi nating tranquilizers yan, meron pa silang sedative effects. Okay, so in here, we have two types of your minor tranquilizers. We have your benzodiazepines and your non-benzodiazepines na tinatawag. Okay, let's start first with your benzodiazepine. So, ang ginagawa kasi, the advantage of your benzodiazepine or yung action talaga ng benzodiazepine natin, it greatly decreases your norepinephrine level and it increases your GABA. That is why, tawag dito, on the other hand naman po, yung ating mga non-benzodiazepines naman, ang action niyan lang or ang kakayahan lang niya is to only decrease your norepinephrine. Okay, so pag titignan natin sino ang mas magandang gamitin for your anxiety disorders, of course, mas maganda yung ating benzodiazepines. Okay, because this medication, they are primarily used for anxiety. Ngayon, ang problema nga lang sa ating tawag dito, sa ating benzodiazepine class, meron siyang fast acting or meron siyang mas mabilis siyang mag-act. Therefore, mas short ang kanyang half-life. Okay? And yung ating benzodiazepines, they can be actually used during attacks of your anxiety or anxiety attacks. And then, on the other hand naman, since yung ating mga non-benzodiazepines, meron silang longer half-life, therefore, okay, sulat natin dito, attacks. Therefore, mas magandang gamitin natin itong mga non-benzodiazepines natin for maintenance kasi they have longer half-life. Okay, the only disadvantage of this two medications sa ating benzodiazepine, they are actually greatly or highly addictive. Okay, and then on the other hand naman, yung ating mga non-benzodiazepines, they provide longer drowsiness to your patients who are actually taking it. Okay, so, tawag dito yung mga example natin ng ating benzodiazepines are here. We have your first diazepam or your Valium. Okay, your Librium, your Alprazolam or your Xanax, your chlordiazepam or your Librium, your lorazepam or your Ativan, clonazepam or your Clonopin, and your oxazepam or your Serax. So, pansin natin, they usually end with a suffix na pam, 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 lam, lam, lam. Except for what? Except for your Librium. Okay, so these are the benzodiazepines that we have or that are actually available. Ngayon, kung tatanungin si sir, kung sino sa kanila dito, sir, ang pinaka-fast acting or sino sa kanila ang may pinaka-fastest effect, of course, it's your Valium. Okay, your Valium, or under your benzodiazepine, this is actually the fastest benzodiazepine to work. Okay, so on the other hand naman, yung ating mga non-benzodiazepine, of course, we have your Buspirone or your Buspar and your Meprobamate or your Miltown or your Equanil. Okay, so what are the different nursing implications when we are going to administer this kind of medication? Okay, sabi natin before, lahat ng ating mga psychotropic drugs, they are best taken after meals. But, meron po tayong exception. Tandaan ninyo ha, lahat ng ating mga psychotropic drugs or yung mga psychopharmacology agents natin, di ba, they are best taken after meals. Pero meron po tayong exception. Why, sir? Because our minor tranquilizers or your anxiolytics, they are best taken before meals. Tandaan ninyo yun ha, lahat ng ating mga psychotropic drugs, they are best taken after meals. Exception po natin is your anxiolytics because they are best taken before meals. Why is it so, sir? Why is it best taken before meals? It's because, di ba, yung mga medications naman natin, it's either nagkakaroon lang naman sila ng ng responsive or reactive. Nagkakaroon ng reaction or response or reaction pagdating sa mga pagkain na binibigay natin. Ngayon, ang problema, kapag respond, okay lang yan, that's normal. But then, pag naging reactive yan, that's not already okay. Kasi, yung ating mga anxiolytics class, they are what? They are reactive to a lot. Okay? They are reactive to a lot of foods and medications. That is why it's better for us to give your anti-anxiety agents before meals. Aside from that one, also, we have to advise our patient to avoid what? To avoid driving kasi sabi natin meron siyang sedative effects. Okay? And of course, we also have to monitor the vital signs. And we have to administer it separately with any other drugs kasi nagiging reactive siya sa mga ibang medication as well as with mga pagkain. Okay, and tandaan ninyo class, every time na magbibigay tayo ng anxiolytics since meron siyang sedative effects. Of course, kapag na-suppress ang ating ang ating CNS, it will result yan sa respiratory depression. Therefore, if you're going to give anxiolytic agent or anti-anxiety, what are you going to prepare? Always prepare what? Emergency equipment available. Why? Bakit kailangan ng emergency equipment? It's because, of course, kapag nagkaroon ng problem, nagkaroon ng severe or nagkaroon ng respiratory depression si patient natin, bumagsak ang BP, of course, we can actually at least intervene urgently or emergently with our patients. Okay, so aside from that one, yung ating anxiolytics plus, anong ibig sabihin yan? Ibig sabihin, what are the hindi pwedeng ihalo sa anti-anxiety agents natin? Okay, of course, number one, we have your alcohol, your another anxiolytics, of course, other drugs, and your stimulant. So, pag pinaghalo mo ang anxiolytics and alcohol, sabi natin ang ating alcohol, it is actually a CNS downer siya. Okay, downer ang ating alcohol. Ngayon, kapag nag-take ka ng anti-anxiety, downer din ang ating anti-anxiety. Of course, pag pinaghalo mo yan, it will result to severe hypotension. Okay, mas babagsak ang BP mo and of course, magre-result din into hypersedation na tinatawag. Aside from that one, kapag nagbigay ka ng anxiolytics with another anxiolytics, of course, sabi natin kanina, meron siyang sedative effects and it will suppress your diaphragm dramatically. Of course, it will lead to possible respiratory depression. And aside from that one, sabi natin, reactive po yung ating mga anxiolytics with a lot of foods and drugs. Therefore, we cannot give it with other drugs because it will lead to CNS depression. For example, nagbigay ka ng mga analgesics natin. Like, nagbigay ka ng opioid analgesics. And yung opioid analgesics natin, it will lead to possible CNS depression. Of course, dinagdagan mo pa ng anti-anxiety, mamamatay ang pasyente mo, it will lead to altered level of consciousness. And of course, kapag nagbigay ka naman ng stimulants with your anti-anxiety agents, like yung for example, coffee, di ba? Stimulant yung coffee natin. Of course, the effect of that anti-anxiety agents is greatly decreased or nagkakaroon siya ng lesser effect or it's even no effect at all. Okay, so that's it for our discussion for your anxiolytics. Thank you.